Good morning, everyone. Good afternoon. Thank you for joining us today. We have a briefing on the endless pandemic versus ending the pandemic. And we will be hearing over the next hour from leading policy experts and policymakers about the latest data, about the current COVID situation, and policy options to end the pandemic. We are going to be joined by a terrific lineup of experts. And at the end, we will open up after a half-an-hour briefing for your questions and comments. And we are live streaming across a variety of platforms. If we could please silence whatever the background noise is there. During the next hour, we're going to hear about how we can end the pandemic. And that is going to require an enormous scale up of vaccines, tests, and treatments. All of the speakers agree it is doable. The question is the pathways. So we're going to hear about various options. All of the speakers agree the one option that is a non-starter is to not act. It is not an inevitable future that we face an inevitable cycle of mutations and variants, the next one of which could be more lethal. And as we saw with Omicron, various infections can lead to long COVID, can reinfect people who already had another variant. It is not a future we want, and it's not an inevitable one. March 11th is the 2-year anniversary of the World Health Organization declaring a pandemic. Almost 1 million Americans, and globally more than 5 million confirmed, and minimally that's an undercount of 2 or 3 times have died. The upper bound data is perhaps 20 million. And that doesn't even speak to the social and economic destruction and the lasting effects of long COVID. But unimaginably, there still is no plan to end the pandemic. Not end coronavirus, end the pandemic. It requires action. The US plays a key role. And that's why we are very honored today to have several leading policymakers joining us, as well as global public health experts, to discuss the pathways. There are different ways to go about it, to ending the pandemic, but clearly not acting is not an option. We are going to start with Congresswoman Jan Schakowsky, whose HCON Res 60, the Stop the Pandemic Now resolution, takes the approach of do all the things. It is a resolution that lays out different pathways to ending the pandemic. And we're going to start with our experts also debunking some of the myths. So without further ado, I would like to introduce Congresswoman Jan Schakowsky. She is the Chief Deputy Whip. She is the subcommittee chairwoman of the Health and Consumer Subcommittee of the Energy and Commerce Committee. She represents Illinois' 9th District and is a long-standing champion for public health and working people worldwide. Congresswoman Schakowsky.
Thank you so much, Lori, and thank you for your incredible leadership. I want to say good afternoon to everyone. I'm thanking all of you who are attending, and I especially want to thank the incredible panel of experts. These are, really world-renowned people who are here, who have been working so hard on this issue for this global effort to stop the pandemic. And I believe that this really starts with the TRIPS waiver and making this happen as soon as possible. And I know that many of you have been advocates for this a very long time. The United States government can play a really important role, an indispensable role, a leadership role in working with South Africa and other nations to quickly and finally get the World Trade Organization waiver and finally overcome the opposition that is now blocking the 130 nations of the world, the majority of countries in the world who want this waiver. The United States government must leverage the massive tax dollars that we are all spending to help develop these vaccines, to help develop the interventions, and to use that in order to get the TRIPS waiver passed. And I feel like we are owed that. And we want to see, even though the President of the United States has declared his support of the TRIPS waiver, we need to do more. And we could launch and help fund global manufacturing to increase the increase and to increase the work that we're doing. This. By helping to create regional hubs around the globe, there are plenty of countries that have the capacity and produce 8 billion more doses of vaccines. The United States government has the obligation to all the people in the world and to ourselves. We have said over and over again that when the virus exists anywhere, we are in danger everywhere, and it is time for us to get to work. We have the tools that we could use, and we ought to put them to work immediately. And I should note, as Lori mentioned, that we have this resolution. We could use your help to get more members of Congress to co-sponsor the resolution that would address all the issues that would allow us to get vaccines around the world, including to get support for the TRIPS waiver. I think that the time has certainly come. We have seen these variants develop. Now we've heard that there's a stealth Omicron, and the fear, of course, is that there would be a variant that would be resistant to all of the vaccines that we have right now. So we need to not give up the fight, not to feel that we are, and not to overplay the downturn now in the numbers of people who are getting sick from these variants. And we need to get to work. So I just want to thank all of you for your advocacy, for your expertise, and for helping us move ahead. I know this has been a long haul fight. But I believe that if we continue to do it, we have to do it, that we can win. So thank you very, very much. Appreciate you.
Thank you very much, Congresswoman Schakowsky. And to set the scene of what the challenge is and to debunk some of these myths that somehow just by nature, we're going to turn the corner and this is going to go away without heightened government action, I'd like to introduce Rita Cranen. She's a policy officer at Doctors Without Borders, Médecins Sans Frontières, US. And she has, with her colleagues around the world in MSF, on the ground providing services, a very good perspective on what actually is happening on the ground vis-a-vis infection rates, variant risks, and access, not just to vaccines, but to tests and to treatments. Please, Rita.
Thanks, Lori. First off, let me thank Rethink Trade and American Economic Liberties Project for organizing this briefing. It's a pleasure to be here alongside Representatives Schakowsky and DeLauro, as well as partner allies. So I work with Doctors Without Borders, or MSF, an independent international organization that delivers medical care to people in crisis in more than 70 countries globally. Around the world, our teams have been caring for COVID-19 patients in treatment centers and hospitals, offering health education, as well as supporting response efforts by local authorities. Last year, MSF maintained dedicated COVID-19 activities in 165 projects in 52 countries. Everything MSF does is profoundly affected by the pandemic, whether it's directly related to COVID-19 or not. Every healthcare worker that spends time managing COVID is, as a result, limited in the other kinds of care that they can provide. And this is in communities that already have little access to care. This means fewer emergency obstetric surgeries, fewer trauma care options for people caught in conflict, and fewer routine childhood vaccinations. In addition to long hours in overwhelmed health centers in hotspots like Brazil and India, our teams have been forced to try to treat patients and prevent this disease in communities without adequate supplies to COVID-19 vaccines, treatments, and tests. To date, fewer than 11% of people in low-income countries have received a single vaccine dose. The COVAX facility was set up as a vaccine procurement mechanism with the aim of delivering equitable access to COVID-19 vaccines in low and middle income countries. Unfortunately, COVAX has failed to deliver on its vision. Of the 2 billion doses pledged in 2021, COVAX delivered only 910 million. As a result, only 5 African countries reached the World Health Organization's 2021 year-end target of fully vaccinating 40% of their populations. Last September, President Biden pledged at the United Nations a 70% global vaccination goal by this September. However, there has yet to be a plan put forth to make enough doses to reach such a target. Low vaccination rates in one part of the world means the probable scenario that the virus will mutate into new variants of concern. We experienced this with Delta and are now in a 4th wave with Omicron. Just yesterday, the WHO announced a new Omicron variant version, slightly more transmissible than the original Omicron. Since the start of the pandemic, MSF and civil society allies have repeatedly said, no one is safe until everyone is safe. What we meant then and still believe today is vaccines must be available to all. Additionally, lack of supply is not only limited to COVID vaccines, but also treatments and tests. The FDA's recent emergency use authorization of Pfizer's Paxlovid, the first oral antiviral to treat COVID, is a remarkable advancement in combating disease progression. Yet the treatment can only be a pandemic game changer if supply meets global demand. As with vaccines, high-income countries advanced purchase supply through at least the first half of 2022. With vaccination rates lagging globally, oral treatments can ease the burden on overwhelmed hospitals, but only if there's an increase in supply and low and middle-income countries are allowed to produce affordable generics. Effective use of treatments also requires access to COVID tests, which remain scarce in many places. The daily testing rate of high-income countries is, per capita, nearly 10 times higher than that of middle-income countries and close to 100 times higher than that of low-income countries. Per the WHO, 85% of COVID-19 infections are going undetected in Africa. For example, in Kenya, nearly 4 out of 10 people live on less than $2 per day, while the average COVID test costs $11. If we want to stop the spread of COVID, we need to make it easier and cheaper for people everywhere to access tests. Finally, I'll just say the public health, human rights, and economic fallout from the pandemic have been grim. Globally, at least 5.5 million people have died, nearly 900,000 in the US. High income as well as low and middle income countries alike have experienced massive job losses, economic contraction, falling investments and exports, as well as a decline in tourism. So therefore, it's imperative that we increase the supply and equitable access to COVID-19 vaccines, treatments, and tests to break the cycle of infections and variants. Thanks, Laurie.
Rita, thank you very much for painting that very vivid picture that makes clear that we have dire shortages in the supplies, 11% to underscore, first shot for people in developing countries, but also now with treatments, given all those folks are going to get infected until they get vaccines, and also the lack of tests. And we hear frequently, well, what can we do about that? Well, our next speaker, Achal Prabhala, has done an amazing study with Doctors Without Borders and Human Rights Watch, where he surveyed the available qualified facilities in the developing world where more of the best vaccines, as in the mRNA vaccines, as we're going to hear from a lot of our speakers, the difference in the quality counts. And so it is my honor to introduce Achal Prabhala. You've probably read a lot of his writing in the last 2 years from Access IBSA, who's coming to us from India to share that research and to debunk this myth that in the face of that dire shortage, there's nothing to be done. Baloney. And now we're going to hear the data. Please, Achal.
Thank you. Personal, which is, I think, something that all of us have had to do with the pandemic. Look, I live in a country that represents something like a sixth of all humanity. We've made good progress with vaccinations against COVID, but there is one thing that we absolutely don't have: mRNA vaccines. Not a single mRNA vaccine has been dispensed in India. And unless we all do something together about this very soon, it's going to stay that way. I work in India, in South Africa, and Brazil. There is some access to mRNA vaccines in South Africa and Brazil, but not nearly enough. The situation that I am in India is a situation that roughly half the world is in at the moment. And at this stage, you might well ask, why does this matter? There are other vaccines, but here's why. So first, mRNA vaccines can be made much faster and they can be reformulated much faster than any other kind of vaccine. They're a hack. I work with an mRNA lab at MIT, and one of the best explanations I heard is that they're a hack because they can be made with routine biochemistry in a test tube, but the body recognizes them as biology. This means that there are a lot of pesky things that mRNA vaccines dispense with, the growing of biological cells, which is complicated and time-consuming. One imperfect but useful analogy may be that if pre-pandemic vaccines, the things we knew as vaccines, were analog, then mRNA vaccines are digital. How much faster are they to make? Well, a lot. So for a batch of vaccine ingredient that took Pfizer about 7 days to make, it took AstraZeneca 2 months to make that equivalent size batch. How much faster are they to reformulate? In the past, it took Moderna 30 days to make a reformulated vaccine ready for trial. And by contrast, it took roughly 5 months for a traditional biological vaccine to be reformulated like J&J. The problem that we've encountered recently is that Omicron has changed the vaccine landscape, and it has rearranged what works and what doesn't. All existing vaccines fared badly under Omicron, especially in terms of protection against infection. As an aside, I should say that many vaccines have been found to work against hospitalization and death, right? And that's a relief. But the effectiveness of mRNA vaccines against transmission of Omicron fell the least, which is a really important thing. It is also why almost no one in the US is getting, say, a J&J booster at the moment. It's also why no one in the UK can get an AstraZeneca vaccine as a booster. They don't work as well. Now, you may say, sure, Omicron is mild. How does this matter? But a surge in cases is why, even in the United States, where you're in mild turmoil. And it's why in India, for instance, my children have had a total combined 4 school days. That's 4 in the last 2 years. So it matters that cases come down. It matters when you have a surge of cases, regardless of the mildness or the severity of the specific variant that we're dealing with. Now, mRNA manufacturers, they already have an Omicron-specific variant in the works. Moderna, for instance, has an Omicron vaccine in trials. When we do have a second-generation COVID vaccine, one that works against Omicron and more, there's no doubt that it's going to be an mRNA vaccine that we have first. I said I'd mix the professional with the personal, and I'll end with my parents. My parents are in their 80s. They live in India, as do I, in Bangalore, where it's 10:30 at night, so good night from here. They deserve an mRNA booster now. And they deserve an mRNA Omicron vaccine when it comes out, as it likely will very soon. But as things stand, they will join about half the world's population in not having any access either to an mRNA booster at the present or a future mRNA vaccine that takes care of all of the variants to come. And it inflames me. I'm genuinely concerned and I'm genuinely angry at a deeply personal level. We need a laser sharp focus on getting mRNA vaccines, not just any vaccines, to the entire world. And the sad thing is that you need it too, because if you fix our problem by vaccinating us with mRNA, we'll fix yours by not sending back variants that make your own vaccines and your lives less useful and less joyful. Thank you.
Achal, thank you very much. And that is actually the perfect segue to Garrett Wilkinson, who's a policy officer from Partners in Health, who, along with James Krellenstein, the managing director of Prep for All, and what looks like about half the medical schools of Harvard, Columbia, et cetera, co-authored a big paper that also looks at not just the mRNA vaccine's ability to be made faster, scaled up faster, and reprogrammed to adapt to new variants, but the way that mRNA vaccines are critical to ending the variant cycle. So please, Garrett, take it away. And I think Garrett will have slides.
Yeah, I'll pull up the slides in just a second. The question we asked when writing the report Lori just introduced is, in light of Omicron, what vaccination series is best at preventing infection, which is necessary to bring the pandemic under control and prevent new variants? And Achal just outlined a lot of that. As I'm sure everybody remembers, last year, many people were saying, if we just vaccinate 70% of all communities globally, we're going to stop all new variants from emerging. And this notion was predicated on the idea of achieving herd immunity, in which we stop widespread transmission. And this is important because every infection is a chance for mutation. Stopping infection and transmission to prevent new variants is the primary goal of the Biden administration's own stated global COVID strategy. But as Achal just mentioned, Omicron has unfortunately changed the game, and we need to wake up to that. Most COVID-19 vaccines do not prevent Omicron infection in the short term, and all COVID-19 vaccines' efficacy has been severely degraded. So I'm pulling up some slides here. I'm not sure if they're sharing on the screen. There we go. And so, for example, recent research from the UK estimates that the AstraZeneca vaccine has 0% efficacy in preventing infection at 6 months after dose 2. However, an mRNA booster significantly rescues that efficacy to between 50 and 60%, although we're still waiting to see how much further it wanes over time. Now, remember, the mRNA vaccines we're using currently target the ancestral Wuhan strain. There are Omicron targeting mRNA vaccines currently being produced right now, as Achal said, for which we'll have data, we think, in March. And we think the Omicron targeting mRNA vaccines will have even greater efficacy and durability against Omicron infection. Furthermore, vaccine efficacy against hospitalization with COVID-19 caused by Omicron is also degraded. The latest research from the UK estimates that 6 months after 2 doses of AstraZeneca, protection against hospitalization falls to around 30%. Fortunately, an mRNA booster rescues this efficacy to about 80 to 90%. And multiple reports are coming to the same conclusion. An mRNA vaccine booster significantly rescues protection against hospitalization to between 80 to 90%, even after 3 months. An mRNA booster has been the standard of care in the US and is in high income countries around the world. And just recently, the World Health Organization updated their guidelines to recommend that most adults get a booster 4 to 6 months after their primary series as well. So this is great. We have a technology that can both reduce transmission and hospitalization. But do we have enough for everyone? And the answer is absolutely not. Last year, we produced only 3 billion mRNA vaccine doses, or 27% of global vaccine production capacity. How many do we need? We think the rough math is pretty simple. Based on the available data, we think people who received inactivated vaccines, like China's Sinovac, will really need 2 mRNA booster doses to achieve maximum protection. The same probably goes for J&J recipients. If you look at the number of vaccines likely already administered, you can estimate that we need 7 billion mRNA booster doses just to reach these people, which is 100% of Moderna and Pfizer's planned production in 2022. And remember, they did not meet their production targets last year. Furthermore, there are still 3 billion people who are unvaccinated and 700 million people who have just received 1 dose. To cover this number of people with mRNA vaccination would require nearly 10 billion doses. So in total, this is about 17 billion doses. And understandably, lots of doses are wasted. In the US, the wastage rate was around 20% last year. So adjusting for this wastage rate brings us to a total need of 22 billion doses. Subtracting planned 2022 production gets us to a 15 billion dose deficit if we want to provide the standard of care to everyone with our existing technology. Now, as I close, let me turn off my slides here. Multiple people have told us don't say 15 billion doses, that will scare people off. Two remarks on this point. Based on experience in the US, we think it will cost no more than $12.5 billion to build a manufacturing capacity capable of producing this many doses per year. And our colleagues at Prep for All think the real cost is around $6 billion. Second, a 15 billion per dose per year capacity would not even get us halfway to the Biden administration's own stated goal for production capacity. If you look at the White House's own pandemic preparedness plan, led by Eric Lander and Jake Sullivan, it clearly states the US needs to be able to produce enough vaccine for the global population within 200 days of recognizing a pandemic threat. For a 2-dose vaccine, this goal translates to about 32 billion doses per year in production capacity. So we know that agencies in the executive branch are more than capable of getting this done and expanding mRNA manufacturing capacity by billions and billions of doses. And when we come back to me in a little bit, we're going to talk about how we can help them do that. So back to you, Lori.
Thank you very much, Garrett. So for folks who have come in and missed the beginning, here's where we are. People around the world don't have vaccines, do not have treatments, do not have tests. If we do not get that number up dramatically, we'll be in an endless pandemic. The good news is, as we have heard over and over, we have the capacity to do this. We have to make the political choices to take the necessary actions. 22 billion doses. This is for COVID. As we've heard more broadly, the US pandemic preparedness plan, not just for COVID, is to have capacity to make even more. So the investment in getting the capacity needed to end this pandemic is part of the long-term investment of being ready for the future, which then begs the question of part 2, which is how the heck does that get done? Now, again, for folks who are not yet co-sponsors of our congressional audience of HCON Res 60, the Stop the Pandemic Now resolution, that's the do all the things resolution. And so we're going to hear about all the things that can be done, because the only option that is not on the table is not doing all the things. So I'm going to go back actually next to Achal, and I'm going to ask Achal to talk about, so he's identified his study, which you can see on Human Rights Watch's website. His study shows there are qualified producers around the world. That's a red herring, that it can't be made, it can't be done. And so how do we translate that potential capacity into the doses that are needed? Because we have a harsh reality. There are a handful of big companies that are the originators of the current mRNA vaccines. They have not been willing to voluntarily share that information. They have, frankly, not even made contracts for manufacturing to get enough volume. So Achal, please pick up from the it can be done to a vision of some of the how it can be done, please.
Wonderful. Thank you, Lori. Thank you very, very much. Look, the really big secret with mRNA vaccines is that they are easier to make and can be made by more pharmaceutical companies around the world that can make the most traditional old-fashioned vaccines. And I understand perfectly that this flies in the face of conventional wisdom. To help with that, my colleague Ala Al-Salhani and I, who worked on this for several months, have an article out a couple of days ago in Nature, and it's titled "Developing Countries Can Make the mRNA Vaccines They Need." I'd urge you to read it if you're interested in learning more, and I'll provide you the short summary of it here, which is, what is conventional thinking? mRNA technology, messenger RNA technology, is brand new. It's never been done. It's super complicated. And that means that no one outside those who are already making it in a few select super specialty plants in North America and Europe can do it. So yes, we'd love to vaccinate the world, but this is so complicated. Now, the interesting thing about that, because I live in India, in a place that I grew up in, understanding perfectly well that there's very good science that happens here and that continues to, is that very early on in the pandemic, that conventional wisdom that you heard and I heard was countered by people from manufacturing in the pharmaceutical industry who said that's just not true. And it turns out that not only is that conventional wisdom wrong, that the inverse is in fact the truth. And I'll explain this. So one of the oldest vaccine technologies that we have in use in the pandemic is something called the inactivated virus vaccine. These are killed viruses where you take the pathogen, the live pathogen, you kill it, and you make a vaccine out of it. These are the two vaccines from China, Sinovac and Sinopharm. This is a vaccine in use in India called Covaxin. Now, to their credit, they vaccinated about half the world with their vaccines. But the thing And again, the dirty secret with the oldest vaccines in circulation in COVID is that they are almost impossible to make. They require facilities that have a safety requirement that is so stringent. They require biosafety level 3 facilities, BSL3. And just, by example, the Wuhan virology lab was biosafety level 4. So to just one notch above this. There are so few of these facilities that these vaccines cannot be made around the world in the same kind of ways that we would expect pharmaceuticals to be made, right? And conversely, mRNA vaccines, our newest technology, is not super complicated, but super easy. I say easy in a qualified sense, right? All vaccines are difficult to make, but of all vaccines, there is no question that mRNA vaccines are, in fact, the most democratically manufacturable vaccines in the world today. And this is something that has been buried with good effect by BioNTech, by Moderna, and by Pfizer, so that you don't understand this and so that you don't ask for the right things to be done around this. mRNA vaccines can in fact be made by any pharmaceutical manufacturer who already makes something called a sterile injectable. So anything that is put into your arm, if it's made by a pharmaceutical manufacturer, that pharmaceutical company can potentially make an mRNA vaccine. We identified over 100 companies across Africa, Asia, and Latin America that can make an mRNA vaccine potentially. These are companies with extremely high quality standards who have exported sterile injectables or biologics or breast cancer biologics to you in the United States or in the European Union. So these are manufacturers who've already made things that have actually gone into your arms, right? And they're located right here. They're located on the African continent, in Asia, several countries in Asia, and several countries in Latin America. And the way in which they can participate in this exercise is by not turning you into a kind of rich uncle that we have to beg every time there's a new variant or every time we need a new booster, because we can kind of do this ourselves. And I cannot stress this enough, how well we can do this ourselves. There are companies already making more complex products. Now, what is stopping them from making an mRNA vaccine? The fact that the only two viable technologies we have are the monopolies of BioNTech, Pfizer, and Moderna. Laurie mentioned a handful of companies. It's 3. It's less than a handful, right, with space to spare. We need to find a way by which Moderna and BioNTech extend the exact same manufacturing contract operations that they have in North America and Europe, because they are engaging other producers to make their vaccines. They just can't make enough of their own vaccine. And what we need to get them to understand is that it's in their benefit, our benefit, and your benefit, finally, as elected representatives and as citizens of the United States, to have us be able to vaccinate ourselves with mRNA vaccines, which are not just the easiest and fastest to make, but will soon become quite possibly the only vaccines truly worth taking to protect ourselves against every kind of possible metric in the COVID pandemic now and going forward. Thanks.
Achal, thank you very much. So again, going back to HConRes 60 and do all the things, there is the option of having the current manufacturers do more contracts to get manufacturing around the world. They have not been willing. It's limiting the supply. Another option that is part of the resolution is to use the existing congressional authorities that exist. The statutory authorities that Congress gave the executive branch, like the Defense Production Act, to mandate technology transfer and the sharing of the recipes so that qualified producers can make it. There's also the option of making more here. I'd like to reintroduce Garrett to talk about the option of making more here and how feasible that is. Again, mRNA, we need more of it, different pathways to get there. And then we're going to hear from Rita about how the obstacles in intellectual property require us to waive the limits on intellectual property in the WTO, the TRIPS agreement. And we have just been joined by the chairwoman of the Appropriations Committee, who is up to her ears and trying to make sure that the government doesn't get shut down on the 18th. So we will pop her in right after Garrett before we go to Rita. Garrett, please.
Thanks, Laurie. I want to back up a moment to give everyone in the room a sense of the enormous consensus on the manufacturing problem and how to solve it. Way back in 2020, global health experts and advocates warned that avoidable vaccine scarcity was coming. Why is this? Because vaccine producers would only invest in limited production capacity to meet demand, because it does not make sense from a business perspective to spend billions and billions of dollars on enough manufacturing capacity to meet global demand immediately. Rather, you can spend a more minimal investment in manufacturing capacity and then collect everyone's money up front and then let them wait for many months in a line as your limited capacity produces doses over a longer period of time. And more doses were produced in 2021 than were delivered, demonstrating that manufacturing capacity rather than willingness to buy doses was the bottleneck. Now, the obvious solution experts proposed was merely for governments to increase the number of COVID vaccine manufacturing lines, especially for mRNA vaccines, at home and around the world. And recommendations poured in to Biden, urging him to scale manufacturing to rapidly meet global needs from people like his chief COVID advisor, Anthony Fauci, the World Health Organization, numerous current and former heads of state, over half of the Democratic caucus of the House of Representatives, including Rep. DeLauro and Rep. Schakowsky, hundreds of scientific and civil society organizations and labor unions, and millions of individuals through petitions. We knew what to do. But what did the US government, and particularly Jeff Zients, do? Well, Jeff Zients didn't listen and instead used about $8 billion not to expand manufacturing capacity, but merely to purchase 1 billion mRNA vaccine doses from Pfizer. And what happened there? That order was put in the back of a very long queue. And as a result, predictably, the US has only donated about 400 million doses of vaccine globally, just 1/3 of our global target. Hundreds of millions of doses the US is supposed to donate have not even been produced yet, because we didn't solve the manufacturing problem. Now, on the contrary, China did listen to the experts, and the Chinese government actually scaled capacity domestically and built factories in developing countries, including 3 in Africa, and have just put us to shame by, to date, exporting 1.6 billion doses of their vaccines to developing countries. That's 4 times what the US has been able to do. Unfortunately, the inactivated vaccines don't work very well. But anyway, so how do we catch up? We think the fastest way to meet global needs is by merely paying an experienced contract manufacturing organization to build a single facility in the US with enough lines to make about 15 billion doses per year, as we outlined previously. The government could own these lines, but they would be operated by a manufacturer, such as Lonza, which already makes most of Moderna's vaccine drug substance. We think this would cost about $6 billion and could be completed in about 4 to 6 months. And this model is called a government-owned contractor-operated model, or a GOCO model, and it has been used since the Manhattan Project to manufacture technologies deemed critical to US national security. It's how we make munitions, including nuclear weapons. We use it to help sequence the human genome and use it to conduct cutting-edge nuclear fusion research. So we know it can make mRNA vaccines. And if Congress got the money to BARDA, they could get this done fast. So what are the advantages of this model? Well, as also pointed out, you can technically manufacture mRNA vaccines anywhere. Unfortunately, none of the 100 producers in the study could immediately begin mRNA vaccine production, even if you shared Moderna's trade secrets with them. You would have to train and equip those workers, which we should be doing with the necessary technology. And even then, it would still take months for them to complete the necessary immunogenicity bridging trials to prove that their product is equivalent to Moderna's or Pfizer's. And furthermore, as we've seen with AstraZeneca, even establishing production in the global south has not resulted in the scale of manufacturing we need to rapidly meet global needs. The Serum Institute of India, for example, which makes AstraZeneca, is also a for-profit company just like Pfizer and is constrained by some of the same market forces. In fact, Serum is one of India's most profitable corporations. Furthermore, the White House is unfortunately staunchly opposed to compelling technology transfer to other countries. But a GOCO model with Lonza, for example, has none of these limitations. It's faster and cheaper for the aforementioned reasons, but also because of economies of scale. Now, globally distributed manufacturing is important and helpful for the reasons Achal and others have mentioned. And myself and my colleagues at Partners in Health have been working to get the mRNA platform to countries in the global south, such as Rwanda. And as we've articulated elsewhere in the report that we talked about earlier, if the Biden administration changed its mind and decided to see mRNA vaccines produced in the global south, this large national vaccine production lab in the US would only make global tech transfer more possible. That's because the US would have funding and personnel trained in rapidly building multiple new production lines. The US could invite select manufacturers from around the world to become part of this process and get robust training in building and operating these lines. The staff involved could then travel to the manufacturing sites around the world and help them become operational, like the US has already done with the bipartisan and popular BARDA flu program. Now, I have to close by saying, and I could not be more serious about this, and there is broad agreement about this in the public health community, Congress needs to understand that Jeff Zients and the White House will probably not be asking for enough resources to close the mRNA vaccine supply gap. If Congress waits to get a top-line number from the White House and merely falls in line behind that, we will fail. Unfortunately, in Jeff Zients, you have a White House COVID coordinator who routinely discards the policies and programs experts recommend for bringing the pandemic under control. You've seen this on rapid tests, antiviral medicine supply, high-quality masks, air cleaning technologies in public spaces, the public health workforce, vaccine production, and much, much more. Jeff Zients ignored calls from the expert community to increase the supply of necessary COVID tools before the winter surge, and is only now starting to take action after intense political blowback for preventable mass death and hospitalization. So talk to the most of the agencies responding to COVID right now. They'll say they're out of money, yet Jeff Zients insists to the public they in fact have plenty of money. So there must be an effort, in closing, in Congress to get billions and billions of dollars to an agency like BARDA to scale mRNA vaccine manufacturing capacity by billions and billions of doses. And furthermore, billions and billions of dollars to agencies like USAID to deliver those vaccines into arms. There are plenty of experts who can help you make that push, but if we fall in line behind what the White House will ask for, I promise we will come up short. So thanks, and back to you, Lori.
Thank you, Garrett. Congresswoman Rosa DeLauro is an enormous champion of working people and access to medicines and public health. As chairwoman of the Appropriations Committee, she has been the person who has created so much positive change in our country in the last year, and also has been a leader on fair trade in dealing with the overreach of agreements like the WTO. Her partnership with Congressman Jan Schakowsky helped lead to the waiver support by the administration of the WTO limits on intellectual property that are limiting supply. It is my honor to introduce Congresswoman Rosa DeLauro from Connecticut's 3rd District, who will speak broadly to all the things that need to be done. We're on a smorgasbord. Folks, when the Congresswoman has to go to vote, do not go away, because we're going to hear from Rita from Doctors Without Borders more about the TRIPS waiver. Congresswoman, please.
Thank you so much, Lori, and good morning to everyone. I guess it's afternoon by now. I want to say a thank you to you, Lori, for your leadership and for on this issue and so many more, and for moderating today's briefing. Again, wanting to say thank you to the panel, to Rita, Chal. Thank you for the wonderful efforts here and what's going on in Africa and what can be done. You're right. There's a mystique about the mRNA, and we need to break that mystique and talk about it and how it can get produced. Garrett, and all, I want to say a thank you for my colleague and partner in so many of these issues, and that's the Jan Schakowsky. You've been just outstanding partners, urging the administration to safeguard America's health and economic security, finally, to deliver on our pledge to save lives around the world by leading the global vaccination effort and end the pandemic, which is why the theme of today's briefing could not be more perfect. We have a simple choice: endless pandemic or ending it. And we can end the pandemic, but that requires action and taking action now. Last year, I held a labor HHS subcommittee of appropriations. I did a hearing with Dr. Kessler, Director Pace, Dr. Disbrow on our nation's role in global COVID-19 vaccine equity. I held the hearing because I am disturbed by the general lack of urgency in ensuring every person across the world has access to the COVID-19 vaccine. While the United States is a leader in the fight to vaccinate the world, I don't understand, and I just say clearly, why is it taking us so long to manufacture the vaccine? For the life of me, I cannot understand why are we still in this predicament. People are dying, time is of the essence, and in the midst of all, Moderna is making billions of dollars, profiting off the suffering of those they refuse to save. I find this situation unacceptable, which is why last November, I joined Congresswoman Schakowsky as a lead co-sponsor of H-Con-Res 60, the End the Pandemic Now resolution. It's critical. It calls for the US and European governments to unite to enact a waiver of trade-related aspects of intellectual property rights at the World Trade Organization to help increase vaccine production and end the pandemic. President Biden announced support for this temporary waiver, and I strongly supported his decision to do so. The only way to end the pandemic, safeguard America's health and economic security, is for the US to deliver on the president's pledge to save lives worldwide by leading the global COVID-19 vaccination effort. HCON Res 60 helps us to move forward toward achieving that end in concert with the president and his administration. We have to deliver on an agreement to waive WTO intellectual property barriers that are limiting the supplies of COVID-19 vaccines, the treatments, the diagnostic tests, critical to ending the pandemic. Time and again, we have made it clear that while we have made enormous strides vaccinating the US population here at home, no one is safe until everyone is safe. And as we all know, the coronavirus continues surging in far too many countries around the world. Now, I too am concerned about what the request may be of what we will do internationally with regard to vaccines. And I'm very concerned, as you pointed out, Garrett, that it will be too little to really make the difference. I don't understand why we haven't used the Defense Production Act. I don't understand why all those efforts have not come into play. It's extraordinary times demanding extraordinary measures. I continue to support what we did last year, temporarily waive some of the world's intellectual property rules to increase global supply. If there's anything we can all agree on, it's people need to have this access. It is a moral. I say this at every one of these meetings. It is a moral responsibility for us to do that. The stakes could not be higher. I think the inaction is not an option. How can we sit around and deal with more death, illness, economic hardship, social, political disruption around the world? That is what underlies this. It is not just about producing a vaccine, get it there. We need to help with the delivery of it, get shots in people's arms. But what are the underlying reasons for doing that? That is what needs to drive this effort. We're only going to be successful if we get the waiver done. But it is only one tool. We have to put the pressure on our pharmaceutical companies. We have to, Moderna, I say this at every turn, Moderna, we provided, federal government provided $10 billion for them to bring their product to market. Today, they don't want to acknowledge the scientific work of two of the NIH's leading scientists in this effort. They want to control the process. We should not allow them to be able to do that. What we can't fall back on is saying that we have made more donations in every country in the world. It's inadequate. And if you have pointed out again, Garrett, that we haven't made good on what we said we were going to do. So this is not the answer to the problem. We need the waiver. We need the might and the strength of the Defense Production Act. We need what I call not nudging the pharmaceutical companies, but applying a hammer to get them to move and to get this done. This is, again, to all of you. Look, I'm a believer. That you continue at doing what we're doing. If they don't hear you today, they may hear you tomorrow, the day after, the day after, the day after, the day after. The last thing you can do is to get frustrated and stop putting the pressure on. So I applaud you for what you're doing today and how we expand the supply of vaccines, how we get them delivered, working with our international partners on this. This is, in my view, again, one of the moral questions of our time, and we need to be on the right side of history. And what that means for me is prioritizing people over pharmaceutical profits and ensuring that a vaccine is a global common good. Doing our part, and if you think about it in terms of just a pragmatic or political terms, the United States should be the leader and exercise that leadership role around the world. And I think that helps to restore our once very important view of the rest of the world, that the United States leads on every front. And on this one, we have not been leading the way. So we need to get it done, and we need to appropriate the dollars. We need the request, and we need to appropriate the dollars in order to make this happen. And it is about saving lives. That is the goal of this effort. There is no nobler goal that we have than to save people's lives. And I thank you for what you are all doing in terms of achieving that goal. Thank you very, very much, Laurie, and thank everyone on the call. I appreciate it. And I am going to dash, if I can. We're in the midst of appropriations negotiations and dealing with the Competes Act on the floor of the House, which I need to go to speak on. So thank you. Thanks very, very much. Thank you.
Thank you very, very much, Congresswoman DeLauro, for your inspired leadership, and run to the floor and save us. A very important part of this effort is your leadership. So thank you so much for finding the time to join us. And I'm going to reintroduce Rita, because what we've heard is whether or not you are going to make more in the US or you're going to make more around the world, and I would say you need to do both. You need to have access to the technology. And what the Congresswoman asked is, why the hell isn't this happening? And I will answer it: monopoly, monopoly, monopoly. I will also answer a question saying the word monopoly that has been asked by congressional staff. Will this be available as a recording? And the answer is yes. And the leading group that's doing anti-monopoly policy will have it on their website, the American Economic Liberties Project, AELP. So yes, this will be recorded and it will be available. But how do we break those monopolies? And one of those things is obviously getting the intellectual property temporary waiver at the WTO. So Rita, can you update us on what is going on there, what needs to be done there? Because again, the only option is that we cannot do is do nothing. We need to do all the things. Rita.
Thanks, Laurie. So I'll start off by saying unequivocally that intellectual property barriers and pandemics should not mix. And as they stand, IP protections allow a company the right to control who manufactures a medical product, and they also exclude other companies and governments from doing so, which ultimately results in less market competition, reduced global supply, and price gouging. So in October 2020, South Africa and India put forward the TRIPS proposal at the World Trade Organization to waive intellectual property barriers on COVID-19 medical tools for the duration of the pandemic. The TRIPS waiver would allow additional manufacturers to make more COVID-19 medical tools and help boost and distribute global supply faster. While President Biden made a bold decision to support the waiver last May, we need the US, vis-a-vis the United States Trade Representative, to lead the international community in adoption of the waiver. And this can't just be for certain products. The WTO must waive intellectual property barriers, not only on COVID-19 vaccines, but as well as medicines and diagnostics, and their underlying technologies, raw materials, and other elements needed for additional manufacturers to help scale up the global supply. Limiting the scope in terms of the kind of IP, the products, and geography will not solve the problem that we are facing, as this is a global pandemic and variants will transcend borders. So where are we in the process? Well, the WTO Ministerial Conference, scheduled for November 2021, where the fate of the waiver was to be decided, was postponed due to Omicron. While small group negotiations continue, the ministerial has yet to be rescheduled, even virtually. The EU, led by Germany, the UK, and Switzerland have yet to endorse support for the waiver. Further, we've heard from informed sources that negotiations continue at the ministerial level, especially among the US, the EU, India, and South Africa. No details nor public information is currently available about the actual progress of these negotiations. However, it seems that there are issues with the US, who remains reluctant to include therapeutics and diagnostics in the waiver scope. As a medical organization, we consider it essential to ensure access to all tools, especially with the current supply shortage of new therapeutics. What can you do? We urge members of Congress and congressional staff to apply pressure on the Biden administration to lead the international community in adoption of the waiver, again, inclusive of vaccines, treatments, and tests. Finally, I'll add that MSF believes it's imperative that the US government demand Pfizer, BioNTech, and Moderna share their mRNA vaccine technology and know-how with the WHO's tech transfer hub in South Africa that stands ready to manufacture more doses regionally. Moderna, who received $10 billion in US public funding, has a particular responsibility to the global vaccine effort. And then, as outlined by Achal, these companies must share knowledge with identified manufacturers in the global South. Thanks, Laurie, back to you.
Rita, thank you very much. And I want to thank all the speakers. We've had such a rich conversation. We've gone a little bit over time with each of the presentations, but it's covered so much territory. I'm sad to say we don't have time for Q&A, but we have covered most of the questions I have heard in advance from folks with our amazing panel. And so I want to thank the whole panoply of organizations and reiterate the study that Garrett's been talking about can be found on the Prep for All website. A recording of this entire presentation and briefing will be found at americanliberties.us. That's www.americanliberties.us, the American Economic Liberties Project's website. And the study that Achal was describing is at the Human Rights Watch website. And Doctors Without Borders' amazing website is stock full of very important information that Rita summarized for us that goes into all of the problems and pathways going forward. If you are a congressional staffer and your boss is not yet a co-sponsor of HCON Res 60, you have heard the smorgasbord of action items. They are all covered by this resolution. Please consider sponsoring. The only thing we can't do is act. I thank everyone for their participation. I thank our audience, and I will bid everyone farewell. This is Lori Wallach, the director of Rethink Trade. Thank you all very, very much.